Thank you for the opportunity to come and talk to you today. I'm going to talk, there were some questions earlier about business models, and my talk will not be so much about the technology. Well, it will be looking at some of the technological capabilities, but it will be through a business model perspective. So I'm going to apologise for the management speak up front, but I'm going to do a bit of management speak at the very start. So our work actually came out to the IMRC in terms of technical product development. But we started to become interested in how you might view medical products through what's called the perspective of product service system. And a product service system is just a little bit of management speak for how people are moving away from selling products to selling services. And it was an obvious example that this is the way healthcare should be going in the future. It's written up in plenty of papers as a sector, which is an obvious example for this movement from product to services. So we were interested in, is it actually happening? And if it is happening, can we find any examples of it? And can we look at what the enablers are for this sort of movement from product to services? So first of all, some very quick, very obvious definitions. Product is what you think, a tangible thing that if it falls on your toes, you know something about it. A service is an activity, and it's something hopefully done for the benefit of others, and it also realises an economic value, and it's often done on a commercial basis. And the system is just a way of bringing these elements together into a total whole. And in management, what people have been looking at is a product service system. And the idea simply behind a product service system in management speak is it's an integration of products and services, and it adds value, gives people value because they are using the service. So they're willing to pay, or someone is willing to pay, a payer is willing because of the use of the service that comes along. And it started off life as a way of actually, in the green movement, because you can decouple the service from a material thing. So you don't have to make something, or you have to make less of something, and you can still provide the service. And this was the origin of the concept about 10 years ago. But it's moved on from there quite a lot, and it's moved on there to a number of industry sectors. And the idea behind PSS is it comes in three flavours. The first one is the one that perhaps everyone is pretty much used to. So the idea that there's a product, and you sell this medical product, a medical device, and then there's something else that goes with it. There's an after-sales service, and that after-sales service might guarantee functionality, it might guarantee durability, it might guarantee lifetime. And so if you, as a company, are interested in this, you might want to be interested in making your products as long-lasting as possible, or whatever it is that affects your costs. For example, if you have to recycle it at the end of life, that might be a design goal for you as a company. It's essentially what we do now. If you move on from that, the next level of PSS is the use-oriented PSS. And here, the customer doesn't own the product. So the customer gets the use of the product but doesn't own the product. And classic examples in this sort of area in other sectors are things happening with Rolls-Royce at the moment. So, for example, Rolls-Royce isn't interested anymore in the business of selling aero engines to aeroframe manufacturers. They sell power by the hour. So they sell a capability, a use of their engines. They look after all the business of making sure the engines are running, and they sell a certain capability out to the airframe manufacturers. No longer in the business of selling aero engines, essentially because of pressure from the airframe manufacturers. And third one is you just sell capability. So now the product is not being sold at all. You're selling a capability out to the audience. And this journey in management speak is called servitization. And what a company does when it servitizes, it moves from selling a product to selling a service. Classic example, photocopier. Photocopiers aren't sold anymore. The ability for a company to make 20,000 copies per whatever is sold. So it's fairly obvious that this is happening in other industry sectors. What is happening in health? And if it's not happening in health, why isn't it happening in health? And that was what we started to have a look at a few years ago. And we started with the obvious example in health. Jennifer's talked about it earlier on. Nice place to start is something like a glucometer, classic product, glucose measurement. And the basic service on a glucometer is you get a reading of blood glucose level. So how long does it take you to do that basic service? So that's a product. It gives you that service of knowing what your blood glucose level is. 2 or 3 years ago, when we looked at them, 90% of glucometers didn't connect to anything else. So no Wi-Fi capability, no Bluetooth, standalone, gave you blood glucose level, full stop. But even back then, people were interested in starting to look at services. So what services could you add on to a blood glucometer device? The answer is things like logging capabilities. So you might be able to put on the device, I didn't eat much that day, or I was stressed, or I fasted. And so if you look across the blood glucometer offerings that were available a couple of years back, you're able to comment on your own food intake. And you are able, this service enables you to start to look at your own lifestyle and changing your own diet to be able to control your own blood glucose levels. So this is a very simple example of on-device capabilities which allow services. So that's an example of a product. A blood glucometer is a classic example of a product in PSS. What then is the example of the system? So to look at this, we started to look at what telehealth systems were available in the UK and how these glucometers fitted in. And there wasn't any information available on this at all, and so we had to map them. And we found at the time, this is about 1.5 years ago, that within the UK there were about 10 to 12 telehealth systems available. It doesn't matter about the detail of this, but the important bit is here's the patient over here, here's the glucometer in this example, and the system is everything else. So the system is the mobile phone or the PC to connect to the web, a portal, PCs over with the health professional themselves, possibilities for electronic patient records. So the glucometer, the product, is a tiny part of this overall system. And we mapped the ones that were available in the UK at that time. And here's another much more complex example. So again, you won't be able to see any of the detail, but these are front-end things. So these are like coagulation meters, pulse oximeters, glucometers, blood pressure monitors, the things that the patient uses. And then the total telehealth system lives after that. And this is pretty much the state of the art and what you can see in systems. Very simply, if you boil those down to what a telehealth system looks like, here's our friend the product, and then the rest of it is health professional, and then some sort of contacting mechanism via the web or via the PC. And when you look at those, you start to be able to see, I'll scroll on to this one, you start to be able to see the business models and the other products that are available in the system. And what's very clear is there is always a second product in these sort of systems. It doesn't have a name, we've called it an intermediate device. And that can be, we were talking earlier on about mobile phones, that can be a mobile phone, it can be a television, it can be a landline phone, it can be a personal computer. And the point of that is to do the data transfer. So glucometer, somehow the data is transferred from the glucometer to that device, and then that device transfers it into the rest of the system. And I think Terry was asking a question earlier on about the way to go with these in terms of smart apps. The history of this technology is to try and combine this with the thing that actually does the medical measurement is a good way for your company to go bust in terms of getting regulatory approval for something that does both the connection with the rest of the system and the medical measurement itself. So what we see in terms of the business model here is that the telehealth companies, it's in their interest to allow any device that's made currently to connect to the system. So their intermediate devices quite happily connect to, if they can, all the current products for asthma, COPD, diabetes, heart disease, etc. And then after that, the system is closed. So they control the data flow after that point, and that's the business model for them making money. So the standard way in terms of a lot of care and health systems at the moment is this system is sold and the maintenance of this system is sold, and because they control the data, they can make the money that way. However, of course, a closed system like this is immediately capable of being disrupted. So in terms of disruptive innovation, what's coming along here in these systems is cutting out all this middleman stuff. So there are now products on the market where, especially in terms of care, you can see pressure sensors, movement sensors, and they have SIM cards in. And they will text a message to a mobile phone that belongs to the carer and say, this person hasn't moved, or this person, in terms of some of the current ones, this person has moved off their current normal walk because they have a GPS monitor with a SIM card strapped to their wrist. No back-end stuff, no call centres, straight to the caregiver, and a way of disrupting this sort of business model. So that's where we got to in terms of, if you like, the products and the systems. What about the services that these things give? And that's actually quite hard to do, we found, trying to figure out what the service capabilities of these systems are. And the way we came down to do it at the end is we tried to look in these sorts of systems what the patient has to do and what is done for the patient. And you won't be able to see the detail of this. You're very welcome to talk to me if you want the detailed papers this is based on. But the stuff on the left of this diagram is things that the system does for the patient. So the health professional creates a patient care plan. The patient is prompted to do something. They're the services in these sort of systems. And the stuff that's on the right here is actually what the patient has to do to interact with the system itself. So you might argue, in terms of PSS, that the best system of all would be where there's nothing on the right whatsoever. The patient actually doesn't have to do anything. The system does everything for the patient. But that's not what we see in practice. It's about half and half. And you can construct similar views for, there isn't much of a role of a caregiver at all in current telehealth systems, but you can construct similar views for the health professional. And again, the health professional is doing rather a lot here in terms of the activities that they have to do as part of this service system. So we were interested in then how you, I'll scroll through that. We were interested in how you, as someone who's buying one of these telehealth systems, tell the difference between the capabilities of one system or another. And we did that very simply by mapping it. So if you're in the market for buying a telehealth system at the moment and you know there's over 10 in the UK, how do you look at one or another and decide which one you're going to buy? Well, one way to do this might be via the system capability map. So you can see the variance between, just in terms of the patterns, between what the patient sees as system services from one system to another. And so we've been looking at this as a tool for being able to tell the difference between current offerings. And you can do that for the patient level, you can do that for the caregiver level, and you can do that for what the health professional has to do as well. Because currently it's extremely hard to know what it is that you're buying, if you're a purchaser and you want to buy one of these systems, what it is you're going to get and how to compare that with anything else. So, the other thing we've been doing more recently, because this is a very important area, especially for the government in terms of looking at telehealth systems, is how do you scale up? So, okay, we've got some systems on paper which we showed there. Do they work with 10 people? Do they work with 100 people? Do they work with 1,000 people? Do they work with 10,000 people? And we've been looking at we've been looking at how to try and model those systems in terms of the current systems, in terms of putting some numbers into them. Again, the details of this doesn't matter. Doing modeling of those systems, totally unreadable, but doing models of what those systems do, putting numbers on those systems and then trying to work out the points at which they start to fall over, or the points at which you need a lot more health professionals for the system to be able to run optimally, as a way of being able, as a way of being able to compare and contrast the current system level offerings. The other thing that we've been doing is, if you're a product manufacturer and you're interested in making money in the future, essentially, from services, so you want to go down the servitization journey, how do you start? And it's very difficult to see how to do that precisely in the medical arena because there are so few examples. But there are more examples in an akin area, which is the domain of people making microfluidic devices, some of which are obviously for medical use, blood capillary devices, for example. So we've been working with practitioners in the microfluidics area to come up with guidelines of how you would design devices for future servitization. So you think about the servitization issues right at the beginning when you design the device. You don't think about designing your device as a standalone product. That work is ongoing at the moment. So, to conclude, the idea of product service systems, where you are much more now selling a service and making the profit out of the service, is very popular in some other industry sectors. What's going on in health? Health is held up as an example in the academic literature of something where there should be PSS, and it should be profitable for companies involved. So we had a look at this, and in terms of what we can see in a classic example, a very well understood example nowadays, which is the example of telehealth, there's little evidence that this is happening in the health sector as yet. People are concentrating on devices. The people who make the glucometer are not usually the same as the people who run the telehealth system, for example. The device manufacturers make the device, that's the end of their input. Little evidence that it's happening, but probably some good opportunities for it to happen. And our current work is really looking at, in business-to-business and business-to-customer cases, well, we know what the drivers are to an extent, but what are the barriers to stop product service systems going into healthcare? Why aren't they having this penetration which people think they might have? Okay, thank you very much.
Thank you very much. Are there any questions? Okay, well, while people are thinking, perhaps I can ask a question.
Yep.
Have you done anything to sort of connect up your system/service view of life with a sort of a business value view to be able to identify some of the hot spots where presumably there will be points here where there's no money being made at all?
Yeah.
And there will also be places where there's actually quite a lot of money to be made for some clever connections.
Yeah.
And you could sort of map out those as sort of a set of hotspots in one of your diagrams.
Yeah.
Have you been able to go that far?
We're trying to do it, but
Okay.
we haven't succeeded yet at all, I
Oh.
would say. So it might be something I should talk to you about, knowing you're
Yeah, sounds
interested in
good
this
fun.
area.
Yeah.
But no, it's a goal of ours because it would be very interesting. It's a sort of the kind of low-hanging fruit example, but yes.
Mm-hmm.
So perhaps we should talk.
Yeah, sure, that sounds good. Any other questions? Question from Tony.
Thank you. Yeah, I was interested from the point of view of medical device manufacturers, a product, as it were. And I know you weren't able to maybe provide an equation or to provide a particular business model, if you like, but in the case of something ubiquitous like a hip prosthesis,
Yeah.
how do you imagine that might work? I mean, would it be implanted into the patient and you charge on a hip stroke hour basis or a step stroke hip basis or something like that?
I think you... well, if you take the Rolls-Royce example, it really is like that. So if you're Ryanair, you pay Rolls-Royce X amount of pounds, and for that they give you X amount of power. So an analogy would be, yes, that you say that you are going to guarantee that the patient will be able to walk so many steps and do it for so many years. Now, there's an awful lot of things in that that are outside your control as the hip joint manufacturer, notably the surgeon, and how well the surgeon puts the hip joint into the body. I think you are, one of the earlier speakers mentioned the Internet of Things, and I think the areas where this is going to happen are going to be where the medical products become more and more informated. So there are information streams coming out of those products on which it is capable of designing services. So the glucometer is a nice example of this. Standalone glucometers, you can almost forget it. You saw the sort of services I put up on the screen. If you make the glucometer Bluetooth or Wi-Fi, you can now start to have a data out source, and you can start to build services on that data out source. So if you informated the hip joint, if you had sensors in the body which told you things, then there's much more chance, I think, of making a proper business case on that than a standalone hip joint with no information capabilities whatsoever.